Hey guys, it's Ruth the RN, and today we're talking about maternal deaths. So, I thought of talking about this topic because I recently watched an episode of The Resident, and it was so powerful. Even if you don't watch the show, I recommend you go watch that episode. It was really good. The episode was talking about it was based off a true story, and it was basically about a mother who came in to give birth and ended up unnecessarily dying. Now, did you know that in the US, a black woman is 247% more likely to die in childbirth than a white woman? In the US, black women are 3 times more likely to die than white women. And in the developed countries, US has the worst mortality rates when it comes to mothers in childbirth. So what does this mean? What are other places doing that is different or better than what we're doing, and what can we do to stop this? Well, there are a lot of factors that play into this, and some measurable and some are not. So one thing that we have to pay attention to is we need to reflect on how we treat minorities. So there has been a study that shows that women are less believed or taken less seriously when they come to the emergency room than men. Meaning that if they come in with a certain pain, when men come in with pain, they are seen quicker and they are seen as more believable and reliable than when women come in presenting similar pain. So that is one factor that plays into it. On another level, you have a black woman who their pain, when they report pain, is not taken as seriously as their counterparts. So the idea is that black, or the misconstrued notion is that black women report more severe pain than they actually are in. So because of that, they don't get the attention and the care that they need in the time frame that they need it. And that is one of the presumed causes of the high mortality rates when it comes to mothers in childbirth. Another thing is protocols and how hospitals and healthcare facilities, doulas, all that handle emergencies when they come up. So actually, California has started a couple new practices and protocols in order to lower the rate, and as of 2017, they had lowered the mortality rate in mothers about 50%. So it's worth looking at what they're doing and trying to implement it nationwide. So something that they are practicing is they practice. That means that they go through emergency protocols for the biggest contributions of maternal death. And two of the biggest complications that lead to maternal death are preeclampsia and hemorrhaging. So in these hospitals in California, they are practicing emergency protocols for when these things do happen. So it becomes kind of like muscle memory when all these staff learns how to communicate effectively and notice earlier signs of complication in these situations, so that when the emergency does actually happen, the team knows how to communicate, and they are so well practiced in their practice that when the actual thing happens, they're able to handle it more effectively. So that is something that is worth looking into for the other states in the US. I urge all of you to speak up for yourselves when you go to a healthcare facility. I urge all of you to speak up for your family members and for your loved ones, and make sure they're taken seriously. Regardless of whether it's in the mother-child unit or any other unit, the emergency room, med-surg, whatever, we have to learn to, one, advocate for ourselves. When you go and you know something's not right, when you feel that something is wrong, it is not, you don't consider yourself being annoying, trying to be the perfect patient. Voice your concerns, voice your opinions, and make it known. And for the healthcare providers out there, whether you are a doctor, practitioner, a nurse, respiratory therapist, learn to be conscious of how you accept your patients. Be conscious of the biases you put towards them because of where they are or where they're from. And this goes, all the way. How white people look at black people, how black people look at white people, the biases we have when we think about Filipinos or Asians or, any other ethnicity, race, age. Think about how you are treating those people differently than you would any other patient, and fix yourself. Recognize that you have a bias and work on improving that. And something that I have noticed in New York is that the hospitals are working more on cultural and emotional sensitivity. So that is something I really do appreciate. So all in all, I just want to say, one, check out the episode. It's based on a real life story on a woman named Kira who unnecessarily died because a doctor failed to believe her when she said she was in pain, and she died a couple hours after childbirth. And it's so wrong and it's so messed up. So I encourage you all to learn up on it, educate yourselves, educate others, and let's all work together to improve the circumstances in these hospitals regarding maternal deaths. I know today's topic was a little serious. I don't want to come with all the fun stuff all the time. I want us to really be able to talk about and explore real things that are happening in healthcare. So I appreciate you watching this video. If you have any questions, comments, concerns, contributions, put in the comments. I will gladly respond, and I will see you next month.